The services performed by the toxicology section of the Division of Forensic Sciences are some of the most sought-after tests provided by the crime lab. Toxicology specializes in the testing of blood, urine, and other biological specimens for alcohol, drugs, carbon monoxide, poisons, and volatiles. Toxicology tests are performed on suspected DUI cases and for post-mortem death investigations. In suspected DUI cases, blood and/or urine can be submitted for testing. Specimens are submitted in a GBI-approved blood alcohol collection kit. These kits include all the items necessary for proper specimen collection: 2 gray stoppered test tubes, a leak-proof plastic screw-capped urine container, betadine swab, needle, labels, security seals, evidence tape, and a submission form. In postmortem cases, in addition to blood and/or urine, other types of specimens can be submitted as well. These specimens include gastric contents, liver, brain, lungs, vitreous fluid, which is the clear fluid contained in the eye, and bile, which is the digestive fluid stored in the gallbladder. Alcohol tests are performed using headspace gas chromatography. This technique is used to test for ethanol, methanol, isopropanol, and acetone. Ethanol is commonly referred to as drinking alcohol and is found in beer, wine, and liquor. Methanol is used as a degreaser and as a canned heating source to keep food warm. Isopropanol is commonly known as rubbing alcohol, and acetone is a paint thinner that is often used in fingernail polish removers. Toxicology testing can determine if any of these compounds are present in a sample, and if found, the chemical can be quantitated to help determine whether or not an individual was driving under the influence in a traffic case, or if an individual may have died as a result of overconsumption in a postmortem case. Cases that need to be tested for drugs are first screened for various classes of drugs using an enzyme immunoassay, which can test for up to 6 classes of drugs and their breakdown products, which are known as metabolites. These 6 classes of drugs, which include cocaine, amphetamines, which would include the street drug commonly referred to as crystal meth, marijuana, opiates, which are commonly called narcotics, benzodiazepines, which are sedatives, and barbiturates, which are prescribed as sedatives and as anti-seizure medications. Blood can be further screened for a wide range of prescription and over-the-counter medications using liquid chromatography mass spectrometry, commonly known as LC-MS. Results of the screen test determine if further testing, known as confirmation testing, is necessary. Confirmation testing for drugs is performed using LC-MS and/or gas chromatography mass spectrometry, which is commonly called GC-MS. The confirmation testing is used to determine specifically which drug is contained in the case specimen, and it may even be used to determine how much of a particular drug is in the specimen. These quantitations may be important in determining impairment in a suspected DUI case, or if an individual may have overdosed in a postmortem case. Carbon monoxide is the most frequently found poison. Medical examiners and coroners can request that blood be tested for carbon monoxide to aid in death investigations. Carbon monoxide testing, when combined with the findings at autopsy, can help a medical examiner determine if an individual was alive at the time a fire started. This can help investigators determine if a victim died as a result of a fire or if the fire was possibly started to cover up a murder. Toxicology tests for other poisons such as ethylene glycol and gamma-hydroxybutyric acid, which is commonly referred to as GHB. Ethylene glycol is an ingredient found in antifreeze, and GHB is used for its hypnotic properties and commonly called the date rape drug. Toxicology also tests for volatile compounds, which are chemicals such as aerosols and solvents that can be abused and may lead to legal consequences such as a DUI or even result in death. Many common household products such as paints, glues, and computer keyboard cleaners are abused by inhaling the chemicals. Toxicology tests for these volatiles by using head-space gas chromatography mass spectrometry.